Hi everybody, it's me, Sushreeya, and today I am back to talk to you about a very important topic that I don't think a lot of us think about. This small part of our body, of the human anatomy, has immense pressure on our body and can completely alter a part of our life. As we all know, the spine is a very important part of our body, if not one of the most important things. A spine injury can cause a lot of health complications, a lot of pain, and it can lead to a lot of different surgical and medical procedures, which take out a huge chunk of our lifetime. But I don't think a lot of us think about this other part of the spine, this other bone, that is equally just as important. Recently, I went through a completely life-changing experience, and along with that, definitely came with a lot of pain that I would never want to relive and I would never wish on anybody else. But along with that came a lot of learning, and I was able to find that small habits in my life can really make or break you. So today I'm going to share a little bit from my experience and some of the really interesting things that I learned that can really impact our human anatomy and our body. As we all know, the spine is a very, very important part of our body. But right underneath, as a part of that spine, right to the bottom, if this was a spine, right here, is called our tailbone, or known as the coccyx bone. Now, we don't think about it every day, but in the everyday things that we do, like carrying our backpacks to work or school, sitting down, laying down, working out, playing our favorite sports, we not only put pressure on our spine, but a lot of pressure on the coccyx or the tailbone. When you stand or you lay down and do things where your body is straight about a 180-degree angle, your spine, as well as the tailbone, remains straight, just like this. When you sit or work out or bend down, your spine does remain straight, obviously. But that small nook right there, which can bend obviously when we sit, the coccyx, when you sit, it bends forth slightly, just like that. As you can see right here, I'm sitting on a cushioned seat. And most of us at home have sofas and couches, and a lot of our seats are actually cushioned, which is a great thing for the coccyx actually, because a cushioned seat like this allows some sort of alleviation to immense pressure which you'd get on a hard surface. The most prominent and common reason that people see every day for a tailbone pain or even an injury is a hard impact or pressure from an injury, usually a contact sport like football or soccer, or just falling down right from the stairs, and that can cause you to fracture your tailbone. This is an immense amount of pain, and fortunately for me, I did not fracture my tailbone. But what I went through was also another similar type of tailbone pain, which we don't think that this can impact our body. But this is also a huge reason of why people get tailbone pain. Sitting for too long. Now I know as students we have to do our homework for a long period of time. People have to work, or even just going out to a restaurant and sitting for a couple of hours with your buddies. Things like this can cause immense amount of pressure on our tailbone, to at which point our tailbone also can't take it anymore. Especially sitting on prolonged sitting for long, hard surfaces, like a seat that is not cushioned, which you might see really, really commonly at places where you have lectures or school. That is why it's really, really important that not only do you make sure that you walk around a little and get in that break, try to comfort your body and sit on a cushioned seat like this. About a month ago, 3 to 4 weeks ago, I started noticing that I was having slight discomfort. It wasn't quite a lot of pain, but when I sat down, I did not feel comfortable at all. When I stood up, obviously it was slightly better. I didn't know why, but it was because when you stand, I wasn't putting direct pressure on my coccyx bone. At school, putting my backpack around my back, which I didn't realize I was putting so much pressure on the area, it hurt so bad. For the first couple of days, obviously, like anybody would, I just took painkillers. I took ibuprofen, the pain went down, came back, I took another dose, and it got better. What I didn't realize was, with that pain, I was actually distracting myself from a really important part of my body, which I should have been giving more rest and more attention to. About a week after that, about 2.5 weeks later, I started noticing immense pain to which I couldn't handle. Right there, we decided to go to the pediatrics like anyone would, and so I went to the doctor. The doctor first obviously asked me, because this was my lower back, have you had any injuries? I'm not in any fall sports, so I didn't have any injuries, which not only puzzled me, but puzzled my doctor. My doctor decided to look for an abscess or a cyst, but that wasn't present either. That was really, really weird, because obviously the most common reason for tailbone pain is an injury. Now, after that, I wasn't able to get up and do a lot of the basic things that I could. It hurt to really do anything. And because of that, I also missed a lot of school, which really, really hurt me. So the doctor decided to tell me to get a cushion. And this is what I wanted to tell you about today. When you have a tailbone pain, it is really, really important to take care of your body all the time, but especially when you have an injury like that. Because unlike other things like the flu, there really is no medicine or no cure for something like this. Sure, you can take a painkiller or something anti-inflammatory, but it doesn't solve it, and it definitely doesn't solve it right away, like you would for a flu or cold. Now, there are many different types of cushions. I first tried a donut cushion, and I know that works for a lot of people, but it didn't work for me. So I got this, which is your standard coccyx cushion. The really cool thing about this, and if you don't have a cushion like this, you can fold your pillow in half and it'll do for now, is in donut cushions you'll see the hole. You put your coccyx bone right in the area where there's a hole. And the really cool part about this is that alleviates pressure from your tailbone. When you have a tailbone injury or even small tailbone pain, the most effective and the most important thing to do is supportive care. Right here, this is how you would sit with your body, you're facing forward like this with your legs sitting out, and you see this area right here, which also supports my calves, and out here it's slightly lifted, I don't know if you can see that, which, since I'm not sitting right on my tailbone, supports my back. If you look at it from right here, you'll see that there's a little wedge here to support my calf, right here to support my back. When you sit on it, your tailbone, this would be if you were facing towards me, your tailbone would be sitting right here. Through that, you would be alleviating the pressure from your tailbone, which is the supportive care that you need to do. Depending on how bad the fracture or your injury is, this can durate from 2 to 4 weeks, 4 to 6 weeks, as long as up to 8 to 12 weeks, which is why it's incredibly important to make sure that you support your body during a time like this. Now, other really small things that I would definitely recommend as habits to make sure that you never have to go through tailbone pain is make sure you have good posture. Hunching forward like this or leaning back too much, especially leaning back, can put immense pressure on your tailbone. And when you have too much pressure on your tailbone, your body can't handle that either, which causes this pain and discomfort and all of this treatment that you shouldn't really have to go through. Another really important thing is I know we all have our things to be focused on in life, but make sure you really take that 5-minute break, not just for your brain and to give it a little break, but for the rest of your body. And with the inertia of our work, we don't realize that not only is it our brains that are completely getting squeezed, it's our body. You're sitting in this still position for so long, and you're putting so much pressure on your back. Getting that little walk in can really help to tense your muscles, because when you sit, your muscles tend to compress inwards towards that coccyx bone, so it kind of squeezes your bone a little. Another really important thing is make sure you take good fluids and you really, really feed your body good green foods. When you have tailbone pain, make sure you really, really eat healthy and avoid eating things that are extra salty or extra oily, because during this time, your muscle around the coccyx bone will be extremely inflamed. So along with anti-inflammatory pills, eat anti-inflammatory foods. Make sure you really take care of your body during this time of period. Of course, I just want to let you know that for somebody that has to go through any sort of tailbone pain, this is definitely a cushion that I would recommend because of all the ones I tried, this is the one that worked best for me. But definitely recommend going through all the other different types of cushions, like different types of donut cushions, different types of coccyx cushions, because you don't know what's best for your body. And another thing is that if you are going through tailbone pain, make sure you take good care of yourself. And when you're looking for something that's supportive care, do not look at that price tag. Look at the quality and think about how you want to get better sooner. But obviously, in the first place, guys, let's make sure that we take care of our brain and our body, the mind and the soul. And that way, we'll never ever have to go through this immense pain. And I am so grateful that I'm able to get better and share this all with you. And I hope that you all are extremely healthy and happy. Have a good one, guys, and I hope you learned something new about the human anatomy. Bye! Stay